Thank you, and could you tell us how to detect early lung cancer and what is the role of early detection of lung cancer?
Okay, the normal lung is a very big organ. So if the early tumor, when the tumor is small, embedded in the big lung, there will be no symptoms. So in fact, most of the early lung cancers, they do not present with any symptoms. And because that, it's very difficult to detect by symptoms. So in fact, a lot of lung cancers are actually detected when they're stage 3, when they're stage 4, where they are spread. We tried to see whether is there any screening test for lung cancers. For example, we do mammogram to early detection of breast cancers. We do colonoscopy for early detection of colon cancers. We tried using chest X-ray as a screening for patients who are otherwise healthy, for those who are at high risk of smoking, like elderly smokers, and we do yearly chest X-ray compared to people who do not undergo screening. Unfortunately, screening chest X-ray has not been shown to be able to detect early lung cancers, did not be able to show to be able to reduce the chance of dying from lung cancers. So at the present time, actually chest X-ray is not recommended as a screening test for lung cancers. So are there any other ways? So actually a CT scan of the lung using low-dose CT scan has been proven in the clinical trials to be able to detect early lung cancers and to be able to reduce the chance of dying from lung cancers. In fact, screening CT chest in normal, otherwise healthy patients but at high risk of lung cancers, like those above age 55, heavy smokers, is recommended in the United States as a screening test to screen early lung cancers. The problem is the recommendation is not agreed by all sectors. The reason is CT scan has own problem. Number one, the dose of radiation is significantly high if you undergo a CT scan every year for X number of years. Second, CT scan is very sensitive. So it tends to pick up very small nodules in the lung. So much so that a lot of all these small nodules, they are actually not cancers. And so they create a lot of anxiety, a lot of worry. And follow-up tests is required to prove whether these small nodules are cancers or not. So I think CT scan lung is probably the best thing that we can do at the present time to screen for early lung cancers, but it has own problem. If there's no screening test, then the next thing what we want to do is the patients who have symptoms suggestive of underlying lung cancers, we want to pick up the lung cancers early. So like a person who is coughing for 2 weeks, 4 weeks, 6 weeks, we advise them to see a doctor and not wait. Because this cough is a very common symptoms. People have sore throat, they have flu, they have cough. So sometimes it's difficult to differentiate between the cough from a non-cancer cause and the cause from the underlying cancers. And that is probably the reason why a lot of diagnosis is delayed. And because the chance of cure is highest when the lung cancer is diagnosed early, so we suggest anybody who has a symptom that is suggestive of the underlying lung cancer seek medical attention early. We also suggest have a low threshold of having a chest X-rays. As I said, the cough is very common, but let's say if a smoker, 60-year-old, who has cough, in addition to the cough, they have weight loss, they have chest pain. So this patient definitely would suggest undergoing earlier investigations. It's unlike a 20-year-old man, never smoked, having a cough for 1-2 weeks, has fever, sore throat. This patient probably do not have lung cancers. So we will suggest that those who are worried, suggestive, seek medical treatment earlier.